Welcome back to the show. Thank you, Dr. Margaret, for enlightening us about the various causes of cancer. You mentioned that viruses can cause cancer. Is cancer contagious? Can somebody who has a cancer can transmit cancer to somebody else?
Right, that is a common concern. In the past, people often stayed away from someone who had cancer because they were worried about catching the cancer themselves. But cancer is not like a cold or the flu. You cannot catch cancer from somebody else. You cannot catch cancer from touching somebody who has cancer. So the bottom line is you should not be afraid to visit somebody who's had cancer, because cancer patients really need our support. And
yes, and another question comes is, can injuries cause cancer?
right, so that's another concern, and it's a myth. Injuries do not cause cancer. The fact is that falls, broken bones, other injuries can bring patients to their doctor, and
but injuries by themselves is not cause of cancer then?
No.
Thanks for clarifying that, yes.
No, the injury did not cause the cancer. The cancer, was likely already there.
Right.
And
can you please tell us about what are the risk factors for the cancer and how can we prevent the cancer?
Right. So I think what we should think about is really what is a risk factor. And a risk factor is anything linked to the chance of developing a disease, such as cancer. There are different types of risk factors. For example, exposing skin to sunlight is a risk factor for developing skin cancer.
Yes, ultraviolet radiation.
Right, but this is not necessarily a risk factor for another cancer, such as colon cancer.
Right.
Some risk factors can cause cancers, whereas some risk factors are more common in patients who have cancer. An example of this would be age.
Okay.
Yeah, so what we know is that women, as they age, have an increased risk of developing breast cancer, but it doesn't necessarily, the age doesn't cause the cancer.
Right, it just predisposes or you're more susceptible to get a cancer.
Right, but risk factors don't tell us everything. Having one or more risk factors doesn't necessarily mean you'll develop a cancer, and having no risk factors, patients often get a cancer. Right. An example of this, we've all heard about the person who smokes several packages of cigarettes per day and lives into their 90s.
Right.
Whereas you can have somebody who doesn't smoke at all and develops lung cancer.
Right.
So, so even if a person has a risk factor, we have no definite way of knowing that the risk factor did cause that cancer.
So how can we prevent the cancer?
Right. We can prevent cancer by reducing certain risk factors that are controllable. So things such as tobacco use.
Right.
Many cancers would be prevented if people didn't use tobacco products.
Yeah.
We know that smoking damages nearly every organ in the body and accounts for about 30% of all cancers.
Wow, 30%, that's a big number.
Right. So this is cigarettes, cigars, pipes, even smokeless tobacco products are associated.
Even the pollution, smoke can cause cancer then probably.
Yes, definitely. So people who are smoking really should try to quit smoking.
Right, right.
And studies clearly show that ex-smokers have a reduced risk of developing cancers compared to people who continue to smoke.
Right. How about alcohol? If alcohol if you reduce the alcohol, can the incidence go down?
Right. Alcohol is definitely linked to certain type of cancers. Some people think that certain types of alcohol are safer than others.
Yes.
And but we know that ethanol is found in all alcohols.
Yes.
Whether it be beer, wine, liquors, and it's really the amount of alcohol that's consumed over time that's related to cancer.
And is diet related with cancer? How about if we change diet and the lifestyle, does the incidence of cancer will come down?
Right. It's not clearly understood how diet is related to cancer incidence, but we know that keeping a healthy weight is very important, and selecting foods that help us do this is important. Particularly eating fruit and vegetables.
Right.
And as a general rule, we should eat about 2.5 cups of fruit and vegetables per day.
Yeah.
We should limit whole grains.
Right.
And
how about red meat? It is known that red meat causes colon cancer incidence increased. So
Right.
if we cut down that, can it reduce the risk of colon
Yes.
cancer?
Limiting red meat and limiting processed meats.
Can reduce the incidence of colon cancer. And how about vaccines which can help to prevent the cancer? Can you please enlighten about some of the vaccines nowadays are available? If you take those vaccines, then the chances of cancer goes down. So can you please tell us something about
Right. Well, one thing that I would like to talk a little bit about today is the HPV
that?
vaccine.
HPV, yes.
That's something that we hear a lot about. And if young people are immunized with the HPV vaccine, it can prevent the HPV infection.
Right.
And as I mentioned a little bit earlier in our discussion, HPV infection is associated with certain cancers: cervical cancer, anal cancer, genital cancers, and oropharyngeal
Oropharyngeal
cancers.
cancers, correct.
And by oropharyngeal, again, it's the base of tongue cancers
Yes.
and the tonsillar cancers. And we see that in men and women.
So one virus related with so many cancers.
One virus with so many cancers. And something that's new is that boys are now immunized,
Right.
or eligible for the immunization.
Wow.
And the government will pay for immunizations for boys and girls
Oh, nice.
in grade 7 at school, and that's given through the local health
So they just go to
units.
the family doctor or a local health
no,
unit?
No, this is given in school.
Okay.
So all of the students, free of charge, are immunized, and they're immunized in grade 7.
Oh, wow.
But for those that are not immunized at that age, they're still eligible for free immunizations up until grade 12.
And how about after grade 12? Can we take a vaccine after grade 12?
Right. It can still be given. It's generally up to the age of 26
Okay.
that it's advised that patients have
So
the vaccine.
once you get the vaccine, then your risk of cancer caused by HPV goes down.
Right. So your risk of developing the HPV infection
And
should be reduced,
Correct.
and the subsequent cancers as a result of that.
Right. That's a very useful information. Thank you so much for giving us so much information. In the next part, we are going to talk about the various diagnosis methods and treatment options available for the variety of cancers. So please stay tuned. We'll be back after the break. Thank you. Thank you, Dr. Anthes.
You're welcome.
Thank you.